The truth about ketamine therapy. Rapid relief or risky trend? You've tried the antidepressants, the therapy, and maybe even supplements, but you're still not feeling like yourself. So what's next? In this video, I'm diving into one of the most powerful and often misunderstood tools in mental health, ketamine. We'll cover how it works, why it's transforming the lives of people with depression, anxiety, PTSD, chronic trauma, complex pain, and how to explore it safely under medical supervision. Okay, so let's rewind. Ketamine was first introduced as a surgical anesthetic in the 1970s. Then came the club scene in the 90s, where it gained notoriety as a party drug. But recently, ketamine has undergone a remarkable clinical rebrand. Today, we're seeing FDA-approved ketamine treatments like Spravato, S-ketamine, for treatment-resistant depression. Clinics like mine are now using low-dose ketamine to help with PTSD, suicidal ideation, OCD, anxiety, depression, bipolar disorder, complex pain syndromes, and more, with results showing rapid relief when nothing else has worked. This isn't just fringe medicine, it's actually based in neuroscience and robust research. I was trained and certified in ketamine therapy in 2019. I see some really complex patient cases, and there were some people that weren't fully responding to their therapies. I wanted to look and unlock deeper psychological healing, so I sought out ketamine therapy, and since that time, I've helped hundreds of patients from ages 14 to 88 years old with success. A question I often get is, how does ketamine help with mental health so quickly? Ketamine targets glutamate, a neurotransmitter essential to brain plasticity. It can act on the MDNA and AMPA receptors, disrupting tight, depressed brain circuits and allowing for flexibility and new patterns to form. You may feel euphoric, dissociated, or mentally lighter during your session. This is the window where the emotional processing becomes more accessible. Think of it as your brain's reset button, the one that also gives you tools to rebuild stronger afterwards. The magic of ketamine doesn't stop when the trip ends. Days following treatment, your brain ramps up the BDNF, brain-derived neurotropic factor, a key compound for learning, memory, and emotional resilience. BDNF helps rebuild neural connections damaged by chronic stress, depression, or trauma. This is where the lasting change becomes possible. But here's the secret. Neuroplasticity is only as good as what you do with it. And it's where therapy integration comes in. I always try to have patients doing multiple modalities as they go through their ketamine sessions. As the brain is open and changing, it's the best time to continue the work with clearing out limiting beliefs or outdated patterns. Let's discuss the clinical use versus the party drug use. I need to clear up this big misconception. Ketamine in the clinical setting is carefully dosed and guided by medical providers and monitored for safety. We're talking micro to moderate doses that allow healing, reflection, and emotional relief. But recreational ketamine, you might hear called Special K or K-holes, is a whole different world. High doses can lead to intense dissociation, memory issues, and even psychological dependence. You know, when I was working with nurses that came from the emergency room setting, they would see ketamine and they would be like, oh my gosh, because they would see the patients on ketamine. So the EMS crew maybe gave their patient a shot of ketamine before they got in the doors as a mild sedative, but ketamine can ramp someone up, and if they're not in the right psychological space, it can make them seem worse. Whereas when we're doing it in a controlled setting and someone's coming to me because they actually want to heal something, they're not in an acute state of psychosis, and we can work through things more logically, and it's not any of those intense experiences that one in the healthcare field might have experienced in more emergent settings. This is why set and setting with supervision are truly everything. At the Health Spa, we create a conscious and intentional healing space, holding space for you to experience this healing in a safe environment. What are the different types of dosing and delivery methods? In clinical practice, ketamine can be administered by IV infusions. This is most common at ketamine clinics. We do 95% of ours is ketamine infusions. There's also IM injections. I love this route because if someone has poor IV access, we can do it IM injection-wise, and it gives a pretty decent, consistent flow throughout their whole session. And then nasal spray is FDA-approved S-ketamine. We do that at different clinics as well. Sublingual, under the tongue, tablets or lozenges are often used for a home-based type protocol. And then there's microdosing. It's still experimental, has mixed results. If people do microdosing, I'd rather have them do psychedelics, if plant-based medicine, if it is appropriate in their state, city, whatever. Each method affects onset, duration, and experience. So the big question is, safe? What about the side effects? Most people experience mild dissociation, which is my goal as a practitioner. I tell them, I want you out of your body, just kind of floating. I don't want you sleeping. I just want you slightly out of your body. So you know that you're in the four corners of our room, but you also might be traveling to the ocean or somewhere else in your brain. It's almost like as the ketamine is doing its work, releasing these BDNF and other factors, it's like playing a TV screen in front of the patient. So they're seeing all these views, and it's a really quick, it changes scenes pretty rapidly. Sometimes they might see colors, they might go places, but again, they know that they are in the four corners of our room. Sometimes patients might experience some mild nausea. We do give like a vitamin nausea injection beforehand just to give them a little energy and to prevent it. But if someone does experience nausea in general, we might give them some Zofran or something beforehand. And then the last thing is maybe a temporary spike in blood pressure. So we monitor vitals before we start the ketamine session. I also have people hooked up to a 2-lead EKG so that they are monitored for their status throughout the session as well. Symptoms are usually short-lived and generally managed when treatment is supervised. Don't know yet is long-term safety with frequent or unsupervised use. And that's why ongoing monitoring and personalized protocols matter so much. So if you're someone with a history of addiction, psychosis, uncontrolled high blood pressure, ketamine might not be the right fit. I have clients that have had schizophrenia, bipolar, and they've reacted really well to this medicine. So don't write it off. I was talk to a provider before doing it, see what their comfort level is, and then go from there. Ketamine doesn't just lift mood, it opens the emotional door for deeper healing. And that's why when we do ketamine sessions, we also include ketamine-assisted psychotherapy with it. It's really helpful, and here's what it typically looks like. So when you sign up and you decide to work, for example, with the health spa, you get 6 guided sessions. We typically do 3 sessions a week for 2 weeks, but sometimes we can divide that further, 2 sessions for 3 weeks. But you want to get those 6 sessions in within the first 3 to 4 weeks to have the best effects. You can notice a difference after the first session, but it really does build on each session. And as you come out of it and you're doing all this processing, you take a day off and then you get in. And so that you're just constantly working, you're constantly using this brain. It's almost like you're working out your brain muscle. And so sometimes people feel fatigued. Sometimes they feel energized, depending on how, just think about going to the gym. Sometimes people feel fatigued after workout and sometimes they feel really good. So it is something similar to that. So working out one time might make you feel good in that moment and might start changing things, but doing the consistent work really does help through. Doing the dosing, depending on how you are. Again, I like doing IV infusion because I can change the drip rate depending on how the person's doing. If they really don't like the session, we can turn it off, or if they get to a really interesting space in it. But 9% of the time, I never turn it off. I just might adjust it mildly, but people typically tolerate it really well. We integrate the sessions. Health spa, we use medical Reiki. Desires to have that, and it's a really good complement. Other places we use psychotherapy, chiropractor in town that does specialized reset techniques, so people can do that. But you've heard of EMDR or brain mapping. Anything like that can keep your brain unlocking those subconscious beliefs is gold. So I always recommend, if someone's doing this work, their brain is going to be open, so keep diving into the work. Most about the integrative sessions with a therapist is that people are able to reflect and rewire. And the result is not just symptom relief, but new stories, new beliefs, and new pathways are created for healing. We always give our patients journals as well. One of my colleagues created this book that is beautiful, explaining the process, and then it gives you journaling is before and after to just contemplate and write your thoughts on. So It's something that it's a tool that I love having them use as well. So my final thoughts, ketamine is not a cure-all, but it's a powerful tool. Used correctly, it jumpstarts healing in ways that standard treatments just simply can't. It creates space for therapy to land, for trauma to move, and for hope to return. If stuck, struggling with treatment-resistant depression, or navigating trauma that feels impossible to process, you have options. Always consult with an experienced integrative provider before exploring ketamine therapy. You deserve safe, science-backed care that meets you where you're at. You can check more details by visiting thehealthspa.com. And if you have any questions, let me know in the comments or ask a question on thehealthypractitioner.com. If this was helpful, please take a moment to subscribe for more integrative medicine deep dives like this one. Have a great day.